Good afternoon and welcome to our Medicare webinar. I'm Deborah Hickey, and I, along with Ellenore and the entire team at Carter Financial Management, want to thank you for joining us today. As many of you longtime clients may know, education is one of our core pillars at Carter and key to helping our clients make well-informed decisions. With that in mind, we want to continue to provide relevant financial planning education and are very fortunate to have Leigh Bennett from IMA Wealth with us once again. I think this is the fourth time that Leigh is with us.
Yeah.
So thank you so much, Leigh.
Thank you.
It's very timely because the Medicare annual enrollment period is from October 15th through December 7th. A little bit more about Leigh. She is a Medicare Advisory Services Sales Manager for IMA Wealth and focuses her attention on providing education, guidance, and assistance with selecting Medicare solutions for individuals transitioning to Medicare. She received her bachelor's degree in communication and public address from the University of Wisconsin-Madison and received 2 designations from the American College as a healthcare consultant and in healthcare reform. She is also annually certified in Medicare product sales. A fun fact about Leigh, which some of you may already know, is that she met her husband while backpacking through Europe after college, and they just celebrated their 25-year wedding anniversary. So congratulations.
Thank you.
Leigh has helped many of our clients navigate Medicare over the past few years. So Leigh, this is a good time if you want to get your slides ready.
Got it.
And just a couple of housekeeping items. So we are going to leave some time at the end of the webinar, probably the last 10 minutes or so, for questions. So please, if you have any questions, use the Q&A, the question and answer tab at the bottom of your screen. Just type in the question and we'll certainly do our best to address those questions at the end. Ellenore will be helping with those. So thanks, Leigh, so much for being here today to share your knowledge and expertise on Medicare. We really appreciate you. Take it away.
Awesome. Well, thanks, Deborah and Ellenore, for continuing to invite me to educate your clients. I do believe education is key, and I'm really happy to be presenting to you all today hopefully a better understanding about Medicare. This is going to be a very general, high-level overview of Medicare, and so hopefully it will allow you to gain that better knowledge and understanding of how it works and some of the Medicare options or solution options that you have available to you. So with that being said, here's a little agenda for what we will go through over the next 45 minutes or so, and then we'll leave a good 15 minutes for Q&A. Most importantly, we'll first talk about the difference between Medicare and Medicaid. I will really just talk about the 2 main differences, but for the purpose of tonight, we will solely be talking about Medicare. We'll talk about original Medicare and all of those letters that go with it. We'll talk about the Medicare solutions, Medicare supplements, Medicare Advantage plans, as well as Medicare drug plans. And then we'll talk about the enrollment periods, one that Deborah just mentioned, the annual enrollment period, which is approaching in just about a month. And then the other enrollment periods that are available to individuals who are Medicare eligible. We'll also touch on some Medicare resources outside of myself that are great resources to utilize. And then sort of a timeline on when I recommend reaching out to someone like myself for assistance with the transition to Medicare. So with that being said, like I mentioned, the first thing I want to do is sort of just go through the differences between Medicare and Medicaid. These 2 terms get confused quite often, and there is quite a big difference between the 2. So Medicare is a federal program that offers health insurance or health coverage for those that are 65 or older, or if they're not yet 65 and have a severe disability, can qualify for Medicare. And this is no matter your income, you can qualify for Medicare for either of those 2 situations. The way that it differs from Medicaid is that Medicaid is both a state and federal program that provides health coverage for those individuals who are in a lower income bracket. And it's for persons of all ages. And so that's, the main difference is that it's an income and age situation or non-age situation with Medicaid. Now, there is the possibility that an individual can actually qualify for both Medicare and Medicaid. And those individuals are known as dual eligibles. And so you can have actually both Medicare and Medicaid, and those two programs work together to offer very low cost health coverage for individuals that qualify. But like I said, for today's purposes, we will solely be focusing on Medicare. So Medicare is made up of several components, lots of letters, which I'm sure you've all possibly heard about. But there are going to be two main components or two main letters of original Medicare. They are Medicare Part A, which is hospitalization coverage, and Medicare Part B, which is physician services coverage. So as I mentioned, these are the two main components of original Medicare. There are a couple other pieces, as you'll see at the bottom of the slide. Part C is Medicare Advantage, and Part D is prescription drug coverage. We'll talk about those in a bit, but for now, I want to focus on those two main components. So as I mentioned, Part A is your hospitalization coverage. So that will cover you in any type of admittance into a hospital, in a skilled nursing facility, home health care, as well as hospice. So all of those fall under Part A of original Medicare. Medicare Part A is going to be premium free for individuals who have worked 40 quarters or more over their lifetime. That adds up to 10 years, and it's non-consecutive employment. So if you worked 5 years, 2 years, 3 years, and then another couple years, you would qualify for premium free Part A. If an individual has not satisfied those 40 quarters and they are married and their married spouse is qualifying for premium free Part A, that person who did not qualify for premium free Part A can actually qualify under their spouse's benefits to receive premium free Part A. So that is an option for an individual who may not have satisfied those 40 quarters. Now, if you do not qualify for the premium free Part A and you are not married to someone who you could file under their benefits to get premium free Part A, you can buy into Part A. And keep in mind, these are all going to be 2023 numbers. The most of the 2024 amounts have not yet been released. So keep in mind, those will be released in the coming months. But for today, we will focus on 2023. So you can buy into Part A, and it will be dependent by how many quarters you have actually satisfied up to the point that you would enroll. The highest premium, or the most that an individual would pay to buy into Part A, would be $506 monthly, which seems like a lot when it can be premium free. You don't see this often. It would be someone more that would perhaps not be a U.S. citizen that did move to the United States and then had a little bit of work experience, but not enough to satisfy for that premium free Part A. But it is still available to an individual, even if they haven't worked the 10 years over their lifetime. Now, Part B is going to be anything physician services. So anything that falls under the care of a doctor. So obviously your doctor's visits, preventive services are included under Part B, diagnostic testing, labs, imaging, outpatient surgeries, those types of services are also going to fall under Part B, as well as durable medical equipment. Part B does have a premium. In 2023, the base standard premium is $164.90 per month. However, this is an income-based premium, and higher income earners may have a higher premium. And in just a moment, I'll show you the 2023 income ranges and the associated Medicare Part B premiums. Now, Medicare Part B premiums are always going to be looking back 2 years in the rear. So currently, the Social Security Administration is looking at the 2021 tax return to determine an individual's Part B premium. They do use a modified adjusted gross income to make that determination. Now, when you are Medicare eligible, you have the opportunity to enroll in A and B. And we'll talk in a little bit about if you should or shouldn't, depending on your situation. However, if an individual is turning 65 and is Medicare eligible, and they are not currently working and will have no other credible medical coverage available to them, they are going to want to enroll in both A and B. If they do not enroll in Part B during their enrollment period, they may have a late enrollment penalty. And that is going to be 10% of the Part B premium for every 12 months an individual is not covered. And this is a lifetime penalty. But keep in mind, if an individual is working and has credible coverage to their employer plan, this penalty will not apply. Well, once again, we'll talk about that in a little bit. But this would be, that penalty would only apply if an individual is Medicare eligible and did not enroll in original Medicare Part B. So as I mentioned, the Part B is a premium-based piece of original Medicare. And in 2023, they are currently looking at the 2021 tax return, and it's your modified adjusted gross income. And you'll see the two different income threshold ranges that helps determine what is the Part B premium for that individual. If you file individually, those would be on the left, and in the middle would be those joint tax return filings. These amounts will change in 2024. The premiums typically go up slightly. I have read that the Part B premium, the standard Part B premium, may go up approximately $10 next year. How the other higher income premiums will be, I don't know, but the base premium is set to approximately go up about $10. But once again, that has not yet been released, and I anticipate to see that in the next month or two. And so this is going to be a individual premium. So if you are a couple and both spouses are on Medicare, you each will have your own Part B premium. And these are paid directly to Social Security Administration. Now, to get into some of the details of those two pieces of original Medicare, there are going to be some costs for medical services. And keep in mind, these are just costs at a glance for just A and B. This would be if you had no other Medicare solution in place. That we'll talk about those in a moment. So if you just had A and you just had B, these would be some of the costs that you would be responsible for. So for example, in a Part A, under the hospitalization, you would have to meet the hospital deductible of $1,600. Once again, this is 2023 deductibles. And that will cover up to day 60. At day 61, then you have a per day fee up to day 90. So it'll be $400 per day, days 61 through 90. And then at day 91, that amount will go up to $800 per day for days 91 through 150. Once again, these are just raw Part A costs. It will also cover you for skilled nursing. However, you will have coverage of $0 days 1 through 20. And then at day 21 to 100, it is $200 per day. So you can see the cost can get somewhat significant. And this is why individuals will look for some type of Medicare solution to put in place to help with some of these out-of-pocket costs. Now, Part B does have a deductible as well, a little bit lower. This year, the Part B deductible is $226. And then after that, you would be responsible for some type of co-payment or co-insurance, probably similar to what you're currently experiencing today on perhaps an individual plan or a group employer health plan, where you may pay $10 for a primary care physician, $35, $45 for a specialist. So you'd have similar costs like that with just Part B. And then, of course, co-insurance, if you were to have some type of outpatient surgery, you'd pay a percentage of the cost of that outpatient procedure. And then Medicare Part B does not pay the excess charges that a provider may charge over and above the Medicare rate. So all rates, even rates for non-Medicare eligibles, are going to be set at the Medicare rate. And a provider has the option to increase their rate up to 15% higher. So Medicare Part B will not cover that overage of the Medicare rate. So that is one thing to keep in mind. Now, here's where I was mentioning earlier, a little bit getting into if you have no other coverage available to you, a penalty may apply if you don't enroll in Part B. Now, if you are still working and you have coverage through your employer, there's an important factor to keep in mind. and that is the employer size based on full-time employees. That will determine who is the primary payer and insurer. So if you work for an employer group that has less than 20 full-time employees, Medicare is primary, meaning your hospital coverage needs to come through Medicare. And most likely your Part B will need to be in place so that your physician services coverage is primary for you. Your group insurance coverage is going to be the secondary payer. If you do not have A and or B in place, you would be responsible for that first 80% that Medicare would have paid. So in this scenario, I highly encourage individuals to enroll it at minimum Part A, because your hospitalization costs are going to be the highest. So if you have Part A, you now have coverage 80% by Medicare Part A, and then the remaining coverage would be through your employer plan, helping with the 20%. Of course, deductible and out-of-pocket max will still apply. And in most cases, I highly recommend enrolling in Part B as well. I come from a more conservative approach. Some people don't want to spend the premium on the Part B and will risk having to pay that 80% of any physician services because they're also paying their premium for their group coverage. So a lot of times what I try and help an individual decide in this scenario is a full transition to Medicare best and more cost effective, providing great coverage. Because if you should have A, which would most likely be premium free, but I'm going to encourage Part B as well to get that full coverage. And at that point, if you're paying Part B premium, perhaps you should consider what your secondary coverage is. And so that's a conversation that I have with individuals all the time. But it is important to note the employer size is key. Now, if an employer group has more than 20 full-time employees, Medicare is secondary. The primary insurer and payer is your group coverage. And in this case, enrollment in Part A is optional, and enrollment in Part B is not necessary. No need to enroll in Part B and have a Part B premium when it's secondary physician services coverage. You will be able to get Part B at a later time when you're ready to retire or no longer have credible coverage available to you, and no penalty will apply. Now, the only time I would recommend someone not enroll in Part A in this scenario is if they are on a high deductible health plan and contributing to an HSA. There is an IRS tax implication for having any piece of original Medicare, A or B, as well as continuing to contribute to an HSA. So in this scenario, if you are on a high deductible health plan contributing to an HSA, you would want to do absolutely nothing with regard to Medicare. There's no automatic enrollment in Medicare. You have to physically go in and enroll. The only time that you are automatically enrolled in Medicare A and B is if you enroll to start taking Social Security benefits. It will automatically enroll you in A and B. And if you're still working and you still have credible coverage through your employer plan and you're not ready to retire, you have the option to defer the Part B. So there's a way to defer Part B at that time and just maintain Part A. Now, if that is the case and you're taking Social Security benefits and you're automatically enrolled in Part A, you've deferred the Part B, and you're on the high deductible health plan, I would stop your HSA contribution. You must maintain Part A when you are taking Social Security benefits. So keeping that in mind as well. Now, as far as employer size, there is one caveat to that, and that would be someone who is Medicare eligible due to a severe disability and is not yet 65. If they work for an employer group that has less than 100 full-time employees, then Medicare is primary. So it's slightly different with that situation if you are on Medicare due to disability and not yet age 65. So just one little caveat with that. Now, I've mentioned a lot of the costs that go into original Medicare, both premium-wise as well as services-wise. And when I was talking about those Part A and Part B service costs, the deductibles and the out-of-pockets, that was simply just having Medicare A and B. And oftentimes what an individual will do is want to add some type of Medicare solution to help with some of those out-of-pocket costs that I mentioned a few slides ago. Medicare supplements are going to be one of those Medicare solutions that are available to any individual that is eligible for Medicare. Medicare supplements are otherwise known as Medigap plans. Same exact program, just different names for them. These are private programs insured by private carriers. So keep that in mind. However, the Center for Medicare and Medicaid Services is sort of the watchdog for these types of plans. Currently, there are 9 available plans for newly Medicare eligible individuals. There were a couple plans that were still available and are still available to those that were Medicare eligible prior to January 1st, 2020. And that is plans C as in Charlie and F as in Frank. Those are only available currently today to those that were Medicare eligible prior to January 1st, 2020. Otherwise, there are 9 other plans available. These plans do have a monthly premium, and that is going to vary by the carrier. So once again, these are insured by private carriers. They base their premiums on factors like age, gender, zip code, smoking status. So that's really how they form their premiums. And the range can be kind of quite large on one plan letter, depending on the carrier. But the best part about a Medicare supplement is that the plan that you pick, no matter which carrier you go with, the coverage is identical. In just a moment, I'll show you a little kind of brief graph of the coverages available under Medicare supplements. But for example, currently the most comprehensive plan available today is Medicare Supplement Plan G. It does not matter which carrier you select. You might be offered 5, 6, 7 different carriers. No matter what, the coverage will be identical. So sometimes people pick a plan or a carrier based on comfort level. Some pick it based on premium. Some pick it based on a household discount offering. So there's a lot of different factors why an individual may pick one carrier over another, but nevertheless, the coverage is identical, which makes making a selection hopefully a little bit easier, and knowing the coverage is very comprehensive. What's really neat about these plans is that there are no networks. That's not a PPO. It's not an HMO. There's no network that you have to think about or even consider. The most important factor with a Medicare supplement is, does my provider or the provider I'm going to see take Medicare? If they take Medicare, they will take any Medicare supplement carrier and plan letter. The coverage will vary based on the plan letter, but they will take anything. So that offers quite a bit of freedom of choice. So, keeping that in mind. Now, I did mention these do have a premium, and these premiums will increase on an annual basis. So that is another factor to consider when making your Medicare solution selection. An individual is going to be guarantee issue on a Medicare supplement plan as long as they enroll within 6 months of their Part B effective date, if they delay their enrollment in Medicare, or right around the time that they're turning 65. So if they turn 65 in July, they have the guarantee issue up until 6 months past July to enroll guarantee issue, meaning no health questions. They are guaranteed the coverage. If an individual does not enroll in that time frame, in that guarantee issue window, they can certainly apply for a Medicare supplement. They will have to answer the health questions, and then that application will go through medical underwriting with the carrier before a decision is made. And that carrier has the right to either accept that individual at the base rate, accept them at a higher rate, or possibly decline them for coverage. So that is an important thing to think about. Some states offer some guarantee issue options outside of that 6-month window, but here in Texas, it is tied to that window. And so if an individual does enroll guarantee issue onto a Medicare supplement, I typically recommend that they maintain that same carrier and plan for the long term, because they're not going to get anything different coverage-wise with any other carrier. They may, though, perhaps get a better premium. So that's the main reason why someone may consider switching, but it's not guaranteed. You must have both Part A and Part B to enroll in a Medicare supplement. And they don't have to be currently active. They have to be active on the first of the month that you want your Medicare supplement to begin. All right. So here is that graph that I mentioned regarding Medicare supplements. So I'm just going to highlight Plan G because that is the most comprehensive plan available to newly Medicare eligible individuals. And you'll see that it's going to cover 100% of a lot of those costs that I mentioned several slides ago. The only thing that this Medicare supplement does not pay for is the Part B deductible. This year, if you recall, that Part B deductible is $226. So that's the only thing that an individual would be responsible for out of pocket other than their monthly premiums. For Medicare approved services, I want to add in. So on day one of your Medicare supplement coverage, you have 80% coverage by Medicare and 20% coverage by the supplements, equaling 100%. On day one of your Medicare supplement coverage, you have to meet your Part B deductible under any type of physician services. And then once that is satisfied for the year, 80% will be covered under Part B of original Medicare, 20% by the supplement at covering the full 100%. There is also some foreign travel coverage on Medicare supplements. It's not super robust, but it's a little bit that makes someone maybe feel a little bit comfortable going outside the United States. I do, however, always recommend having some type of short-term international travel medical coverage in addition to this if they do have a Medicare supplement, because the lifetime max on a Medicare supplement would be $50,000, and that can go very quickly in a bad situation. So another option, an alternative option, I should say, to another Medicare solution would be a Medicare Advantage plan. And this is actually going to be Part C of original Medicare. So one of the original Medicare letters, but this is actually insured by private carriers. So it's run by the insurance companies, the programs are. However, it is a Medicare plan or program, I should say. Medicare is going to pay a fee to the carrier for each enrollee on a plan. So the carriers are going to benefit from individuals being on their plan because Medicare pays them a per enrollee fee. All the care and claims, though, are going to be handled by that carrier. And then CMS, the Center for Medicare and Medicaid Services, is the regulatory agency that monitors and certifies all of these types of plans each year. There are several different types of Medicare Advantage plans. The two most well-known are going to be HMOs and PPOs. So this is a network-based program. So you do need to be thoughtful about a network on a Medicare Advantage plan. An HMO is going to offer only in-network services except in an emergency. And a PPO is going to offer both in and out of network services. And in an emergency would be covered in network on a PPO. So those are the two main Medicare Advantage plans and the ones that we will see the most when we're looking at options. However, in some areas, there are private fee-for-service plans, which are a little bit more like a supplement, offers a little more flexibility. You don't have to be tied to a network, but you have to make sure your providers accept the terms and conditions of the plan. So it's a little more work on the individual's part, but it does offer a little more flexibility. And then there are going to be special needs plans that are designed for individuals who either are dual eligible, have both Medicare and Medicaid, or if they have or develop a chronic illness. And those will work really well with someone who has a certain kind of illness, and then they can provide the extra care that they need for that particular medical need. One item I did not mention in the last slide, so my apologies, is that oftentimes a Medicare Advantage plan will also include the prescription drug coverage, and that would be referred to as an MAPD plan, Medicare Advantage Prescription Drug Plan. So as far as eligibility requirements, pretty simple. You just must reside in the service area of your plan, and you must be enrolled in both A and B. You are going to be guarantee issue on a Medicare Advantage plan. You just must enroll during the appropriate enrollment period. So we'll talk about that in a bit, but there's no health questions. You're guaranteed the coverage. It's just, once again, during the proper enrollment period. Now, the value proposition, why these are so neat. Oftentimes, you are going to have either a $0 monthly premium or a very low premium for the policy. So while you'll still be paying your Part B premium, the coverage to help with some of those medical costs is going to either be $0 or very low premium, which is ideal because it's just a great cost saving situation. And then after that, as you have incur medical services, you would have small copays. Typically, primary care physicians are going to be $0 as long as they're in network. And then specialists are somewhere 35, 45 in that range for in-network services. You may have some co-insurance, so a percentage of the cost of an outpatient surgery or some diagnostic testing, et cetera, but there will be smaller costs than what you would pay without any insurance. Once again, guaranteed issue, so no health questions, and they can include that drug coverage, which we'll talk about in a moment, which is required once you are Medicare eligible. And then what's also neat about these plans is that they may include some extra benefits that Medicare doesn't cover. So Medicare doesn't cover dental, vision, hearing. So you would have to purchase that separately if you did not have a plan like this to have any kind of dental insurance or vision insurance or even some hearing coverage. So these Medicare Advantage plans often include some of these routine types of coverage at, once again, no cost. It's all included. So you have your coverage for your hospitalization, your physician services, your drugs, and then you may even get some extra benefits like some routine dental care, vision services, and hearing benefits. And then they also offer some fitness facility benefits. A lot of these plans are now offering either Silver Sneakers or Renew Active, which allows you to join a fitness facility at no cost. So once again, another $0 premium or cost. As well as some over-the-counter allowances where you can buy over-the-counter products. You get a quarterly allowance, so you're getting like free stuff. So they're really neat and certainly worth a consideration when you are making your Medicare solution selection. Now, I mentioned a moment ago that prescription drug coverage is required once you become Medicare eligible. And so that's why this is real important. So Medicare Part D, another one of the letters of original Medicare, is available to all people with Medicare. And you only need to have Part A and or Part B to enroll. So that's certainly a little bit different than for the Medicare Advantage and the Medicare Supplement. And you can get a credible drug coverage either through a standalone Part D prescription drug plan, through a Medicare Advantage plan, which I just mentioned, or some employers or unions offer retiree coverage for drug coverage as well. Now, if you're covered under your employer plan because you are still working, that will more than likely offer you the creditable drug coverage you are required to have. But your employer will, if you're still working, will send out Part D notices to you about this time every year to let you know whether the drug coverage on your employer group health plan will meet the criteria for credibility. So most times they do meet the credibility factor, but it is something to be thoughtful about if you are Medicare eligible. So a standalone Medicare plan, Part D plan, averages somewhere between $15 and $150 a month. And I know that's a very large range. This is, throughout the United States. I would tell you here in Texas, we have a couple plans that are under that $15 amount. And then I don't work with any plans that are higher than just over $100. But the difference is going to be that the lower premium plans are going to be more basic plans, great for someone who's taking no meds or taking very inexpensive generic meds. Those more expensive premium plans are going to have richer formularies with more comprehensive drug coverage for individuals who may have some more significant prescription drug needs and find their drugs in higher tiers, tier 4, tier 5, and into tier 6. The base premium for 2023 is $32.74. So that's sort of the average for all of these plans throughout the United States. And I did mention that this is a required coverage, some type of creditable drug coverage once you become Medicare eligible. If you do not have creditable drug coverage from the time that you are Medicare eligible, you may incur a late enrollment penalty. and it will be 1% of the national base Part D premium for every month that you were not covered. And this is a lifetime premium, or excuse me, penalty, excuse me. So it's important to know if you're on an employer plan that it is creditable, and if you're Medicare eligible and don't have employer coverage, that you have some type of drug coverage in place. Now, same as with Part B, Part D may have a surcharge premium for those individuals in the higher income thresholds. And I'll show you how that works in a moment. There we go. So if you enroll in a standalone drug plan or even a Medicare Advantage plan, if that plan has a premium, you'll pay that premium to the carrier directly. Or you can actually have Social Security pay that if you are taking benefits. But if you are in one of the higher income thresholds, you may owe an additional premium that will get paid to Social Security Administration. So for example, on the second column or second line, where it says $12.20 plus your plan premium. So if you are in either of those income thresholds from year 2021, you have a standalone Part D drug plan and you're paying $11 per month for your drug plan, you're going to pay that $11 to the carrier, or that amount is going to go to the carrier. And then you will owe Social Security Administration an additional $12.20. Once again, these thresholds are probably going to change slightly for 2024, as well as the surcharge premiums. I anticipate those to be released in the next month and a half or so. So hopefully we'll see those soon. And Social Security Administration will correspond with you once you enroll about your Part B premiums, as well as any Part D surcharge premium you may owe. Now, to get into some of the details of a Medicare Part D prescription drug plan, there are 4 phases in a drug plan, and it's going to be the same whether you get a standalone version or you get your drug coverage through a Medicare Advantage plan. So a lot of plans will have a deductible. This year in 2023, the max deductible is $505. And that typically is going to count towards tiers 3, 4, and 5 medications. So some of the higher cost medications will count towards that $505 deductible. If you have a medication in tier 1, a preferred generic, that's not going to count towards the $505, typically at $0 or just a couple dollars. So once you meet the Part D deductible of $505, if you have to meet that, then you move into phase 2, which is initial coverage level, or that's the initial coverage phase, if you will. And this is when you and the drug plan are sharing the cost of the medications. You're paying typically a copay, a set copay for that initial coverage phase. When you and the drug plan together combined hit a total of $4,660, that's when you move into phase 3, or the coverage gap. This was once known as the donut hole. They're trying to kind of get away from that terminology, but it is the coverage gap. And here is where you will pay 25% of the retail cost of the medication. Some people hit the coverage gap during the year. Some people don't. Some people may hit it right at the very beginning of the year. Some may not hit it till December. It just depends on your medications and the cost of your medications. And then if you were to spend in a plan year $7,400 total out of pocket yourself, you then move into the 4th phase, which is catastrophic. And at catastrophic, that is when your cost of your medications will drop significantly. You will pay the higher of the 5% of the cost of the drug, or $415 for generic, $1035 for brand, whichever is higher. There is some kind of changes for next year. Now, all these amounts, pardon me, are going up slightly. But when you get to catastrophic in 2024, you will have no additional costs for medications. So that is a really good change for next year. So I was happy to see that. Now, enrollment periods. Talked a little bit about that. So I'm going to get into some details about enrollment periods and what might be right for you. So an individual is in their Medicare initial enrollment period the 7 months surrounding their 65th birthday. It will start 3 months before their 65th birthday month, include their 65th birthday month, and extend 3 additional months past their 65th birthday month, making 7 full months of that initial enrollment period. So if an individual is turning 65 in September, their initial enrollment period began June 1st. They had June, July, and August to enroll for it to Medicare to begin September 1st. If they did not enroll during the 3 months prior, they can enroll in September, and their Medicare enrollment effective date will be October 1st. If they wait till October, then there will be a slight delay. And then again, if they wait till November and December, the delay continues. So you do want to make sure, if you do not have other coverage available to you and you are Medicare eligible and you're going to need to enroll in Medicare, to think about these delays in enrollment. So if you wait till after your 65th birthday month, it's going to be 1 month delay if you enroll 1 month after your 65th birthday month. So if you enroll in October, it would not start until, hold on, 2 months, I'm sorry. It's always very confusing. I always have to double check this. In October, it would start December. And then the delay goes 2 months further after that. So I highly encourage individuals to try and enroll in those first 3 months, so that everything is all set up the first of the month of their 65th birthday month. If your birthday's on the first of the month, everything starts a month sooner. So you are Medicare eligible. Let's say September 1st is your birthday. You are actually Medicare eligible on August 1st. And everything started 3 months before that. So May, June, July, August, September, October, November. So that's how that works. Now, if you miss your initial enrollment period and you do need to enroll in Part B, there is what's called the general enrollment period. This is going to run each year from January 1st to March 31st. And it will be an opportunity for you to enroll in Part B at that time, and coverage will begin the first of the next month, but it's a short time frame. So if you want to do this and you're in April, you have missed that window and will have to wait until the end of the year to re-enroll. So keeping that in mind. And then, of course, the annual enrollment period, which is about to come up, just under a month, or just over a month, excuse me. And that runs every single year, October 15th to December 7th. And this is the time frame when individuals who are currently on Medicare have the opportunity to review and either change their drug plan or their Medicare Advantage plan, or sometimes they just stay with what they have if that plan is continuing on into the new year. But you do have that 7-week window to make that selection. Otherwise, whatever selection you made will stay for the entire year of 2024, for example, with the little caveat that I'll mention in just a moment. And this is also a time when, if perhaps someone didn't enroll in a Medicare solution, drug plan, or Advantage plan earlier in the year and they missed their opportunity, this is their time frame when they can first enroll in a Part D plan or a Medicare Advantage Part C plan, and it would start January 1st of 2024. Now, if they did not, and they did not have credible drug coverage, the penalty may apply. Now, the caveat I wanted to mention is that when you make your selection during the annual enrollment period, whether it's to stay on the current plan you're on this year for next year or move to a new plan, once December 8th hits, you cannot change your plan for 2024, except Medicare Advantage plans have a one-time enrollment period. It's called the Medicare Advantage Open Enrollment Period. Also runs January 1st through March 31st, and it gives Medicare Advantage members, enrollees, a one-time opportunity to make a change, either to a new Medicare Advantage plan that would stay for the remainder of that plan year, or disenroll from the Medicare Advantage plan they enrolled in, and then they can enroll in a Part D standalone drug plan. So that's that one-time change caveat that I wanted to mention, but for the most part, you are going to stay with the same plan for the entire year. But they do let you change it every single year, which is great. And then the special enrollment period. And this is going to be for someone who delayed their enrollment in Medicare because they were still working and they had credible coverage through their employer plan, and they're ready to retire. And they have what's called a special enrollment period because they are going to be losing their employer coverage. And the employer will fill out a form on their behalf stating they've had credible coverage since turning 65. They submit that with a Part B enrollment form, and then they can enroll in Part B with no penalty whatsoever. And then, of course, I mentioned the service area for the Medicare Advantage. And then as far as service area drug plans, you must reside in the same service area as your drug plan as well. If you move, that opens up an election period for you to change either your Medicare Advantage or your drug plan. Because if you move outside the service area, you will be disenrolled if you do not actively make a change to a new plan in your new service area. If a plan terminates, which I have never experienced that in my 12 years of doing this, but I'm sure it's probably happened. And then if you become dual eligible and are now qualifying for both Medicare and Medicaid, that opens up a special enrollment period, as does developing a chronic illness. Now, I mentioned in the beginning, I want to share with you some really great Medicare resources that are available to everyone. The first one is the State Health Insurance Assistance Program. They are counselors. They are state-based. So if you call that 1-800 number or go to the link, you will be connected with someone in the state of Texas if you are living in the state of Texas. And what they do is they help you determine or look at, Medicare plans versus your employer plan and help you determine which is going to be the best plan for you or the best situation for you. But they are a great initial step as a resource if you are considering a transition to Medicare. The other one is Medicare.gov. I would tell you, I kind of use it daily, oftentimes to share information with clients. It is a lot of information. I'm going to warn you, there's a lot in there. But there is a search feature at the top right. You just, once you plug in some keywords, you can hit the magnifying glass and it comes up with a whole list of recommendations of what you want to consider and look at. So that's a really good resource. I highly recommend people kind of peruse it. Sometimes people can feel a little overwhelmed, and I get that, but it's certainly a great resource. You could also call 1-800-Medicare. I think the website's going to offer good information. And sometimes getting a hold of someone is sometimes a challenge. So just keeping that in mind. And then if you are Medicare eligible, one resource that's not on here, but I wanted to mention, you've already turned 65 or you're about to turn 65, you should receive a huge Medicare and You handbook in the mail. It's probably about this thick, 180 or so pages. It's a great resource. I have PDF copies of it. You can also Google it and you can download a PDF copy. It's a great resource as well. Also, a lot of information, but really good information. And then, of course, someone like myself who certifies annually to sell Medicare solutions would be another resource for answering questions about Medicare, understanding Medicare a little bit better, and help with the solutions piece as well. Now, as far as timeline, if you are turning 65, and you have no other coverage available to you, and you are going to transition to Medicare, I typically suggest that someone reach out to someone like myself about 2 months, maybe a little more than 2 months before their 65th birthday. If you recall, they can't do anything with regard to enrollment in Medicare A and B until 3 months before their 65th birthday. So if they reach out that very first month of their initial enrollment period, that is perfect timing. Now, if you are coming off of an employer plan and you're already 65 and you delayed your Medicare Part B enrollment at minimum, I suggest at least 3 months. The reason being is that the Part B enrollment may take some time to process through Social Security Administration. From what I understand from other clients and their feedback, they're being told by Social Security Administration it's currently taking 6 to 8 weeks to process applications. And so you must have, if you recall, for any of the Medicare solutions, must have Medicare A and B for 2 of them and Medicare A and or B for 1 of them in place and have a Medicare number in order to enroll in those solutions. So you want to be thinking about your timing and keep in mind that 6 to 8 week, kind of pushing towards the 8-week time frame for processing that application. And once someone does reach out to me, I go through a lot of this information we talked about today. I'll answer questions about Medicare A and B, what it covers. I also provide quite a few resources to individuals that do engage me in, to help them with their transition to Medicare. We do a Medicare needs assessment. Sometimes people tell me they know exactly what they want. Sometimes they say, let's look at both solution options. We'll do that for sure. And then we go through those solution options, and while I can't pick a solution option for an individual, I kind of give them the highs of each so that they can make a good informed decision. And then I assist with enrollment of all applications with regard to the solutions. Everything's really done electronically now. They're really pushing us to do all electronic applications. So it's usually a phone call, which makes it super simple. And then I track all those applications, and once confirmed, I let my clients know. And then every year I reach out to my clients just before the annual enrollment period to let them know it's time to start considering their options. So here's a little information, and this is my phone number, and my email address will be on the far right. Email is always great. Due to Medicare regulations, we are required to record most Medicare related calls. And so that is why I do have a toll-free number. And sometimes when I do call people back, it goes to voicemail. So I often like to tell them in advance I'm calling from a toll-free number. So certainly feel free to reach out to me with any questions outside of anything that we discussed today. And Ellenore, I think I'm turning it over to you for Q&A.
Yes, and we do have quite a few questions that have come in.
Okay, great.
So that's exciting because I've been writing down a few questions for myself.
Fantastic.
First of all, Leigh, I just want to say thank you so much. Have a drink of water because you've been talking a mile a minute. This stuff is super complicated, and I know for some people this is their first stab at this. Don't let it be overwhelming to you guys. Leigh can make it as easy and as easily digestible as possible. She has just helped my husband go through this, and she was brilliant. She helped him. He had to get in July. She started in April or May with him, and they chose the right plan. They chose the right way to approach it, and it was just smooth sailing, and he could not say more wonderful and laudatory things about Leigh Bennett. So if anybody needs these slides, we can get these slides to you, and we will do so. Just email us, and we can certainly share this. This has also been recorded, so Deborah and I will hopefully be getting this up onto the website so that anybody can rewatch this at their leisure, and slow it down and go parse all these many different letters that are being thrown about in willy-nilly fashion. But let's get to the questions now, which are very, very important. Does Medicare pay for the long-term care expenses?
Nope.
Okay, no, it does not. All right, so that's something to be aware of. We at Carter deal a lot with long-term care planning, especially as far as getting some insurance around those kinds of things. And there are quite a lot of really good products out there that can help with long-term care insurance. So if anybody has a question about that, please contact your Carter Wealth Advisor or contact either Deborah or myself, and we'll be glad to help you sort that out. What is the downside to an Advantage plan?
I personally don't have any downsides to Medicare Advantage. I think they're fantastic. I mean, they just keep adding more and more benefits to these. The coverage just seems fantastic. This is the funny thing about Medicare Advantage. They have a bad rap. And I think that's the hard part that I have to overcome with my clients, because they hear things from various people, or doctors' offices will say, don't do Medicare Advantage. You'd be surprised how many offices take Medicare Advantage plans. I think they look and feel just like employer group health plans. So in my opinion, they are a great transition from someone's employer group health plan onto a Medicare Advantage plan. Employer group health plans are typically PPOs, sometimes HMOs. They have in and out of network services. You have to meet an out-of-pocket max before the plan starts paying. It's the same type of experience, if you will, with all these extra benefits. And most likely you're paying nothing or a very small premium. So I don't have any downsides to them. I think if your doctors, your providers that you like to see don't take them, then that would be the downside. You want to ensure, and I do some research into this, whether one's providers do accept a plan that I'm going to recommend. I have at times had to say, I can't find any of your doctors with any of these plans. I don't recommend this type of coverage for you, but they can still enroll in one. They have the opportunity, but I think these are just getting better. And what I'm seeing for 2024, just off the glance that they give us, because they won't let us see anything until October, they even look richer and better, and they're great. So, but they have to be the right fit too. That's the one other thing I want to make sure to say. I'm not going to push them if it's not the right fit for that individual. The good thing is that there's only 2 solution options. You can go with a Medicare supplement and a standalone drug plan, or you can go with a Medicare Advantage prescription drug plan. That's really as simple as it is. So.
Okay. And Joanne asks an interesting question. How do premiums on the Medigap policies increase as we age? Do they increase based on inflation, or is the premium age related, or both?
A little bit of both. I'm not sure inflation as much as the health of the area that you live in. I think that's a big factor in the increases. So it's ultimately going to be the carrier's decision how much they're going to increase each year. Some of them do increase annually and also attained age. So when you hit certain age thresholds, typically it's the loss ratio will decide what their increase will be. So the loss ratio is basically how much premiums did they receive and how much did they pay out in Medicare claims.
So it's similar to other insurance policies.
Correct.
Okay. Got it. Why would one select a Medicare supplement versus Medicare Advantage?
I think, once again, it has to be the right fit. Medicare supplements offer that freedom of choice. Some individuals really want that freedom. But, we do a little bit of a dive into both to see what's going to be best. Some people like the idea of paying for the premium and not having very little out of pocket for medical services. I do have a client that's going to be having some cataract surgeries, and she thinks Medicare supplement might be a better solution because once she meets her Part B deductible, she won't pay for anything else.
Okay, so it just depends. And then obviously she could change the next year should she desire to do so.
Yes. So if you're on a Medicare supplement and you got on guarantee issue, remember, you can't change supplements without answering health questions down the road. But the easiest thing to do is go, if you wanted to, you go from Medicare supplement to Medicare Advantage, guarantee issue. Just have to do it during the annual enrollment period. It's a little harder to go the opposite, Medicare Advantage to supplement, because it will require some health questions to be answered. But
that's something
it's been done.
About.
Yeah. And these are things that conversations I have with my clients in the process of making that selection.
Got it. Brenda asks, do all drug plans cover the same list of drugs? I think you sort of answered that when you were saying about the costs of those plans, but can you review that again?
Yes. So, formularies are going to be different for each plan, each carrier, et cetera. The lower premium plans are going to have more basic formularies and perhaps may not cover certain higher tiered medications. There are some medications that I see a drug plan not cover that's covered by another plan. So it's sort of, there's a whole algorithm built into the Medicare site. I use a program that has a similar algorithm. It's the exact same thing, actually. And I plug in people's medications, their dosages, their frequency, and then it calculates what is going to be the best drug plan for that individual based on overall cost. So sometimes a higher premium plan may cost someone less in medication and be better cost overall than a low premium plan. So there's a lot of factors to think about. But not every plan is going to cover every single drug. I do know that because I've seen that through experience.
So that's something that you have to go to the plan,
yes.
And you can put in the drugs that the person currently takes, and
exactly,
okay. And that way you can really pick the absolute best plan for the person.
Exactly.
Got it. Scott says, first, terrific presentation, which I heartily concur. Very helpful. My question is, do you have to work full-time after turning 65 to defer Part B? If you only work part-time but have the full credible insurance you had when working full-time, does that allow the deferral?
So that kind of depends on the employer. If you are working part-time I was always under the assumption that 30 hours is the minimum to offer benefits to an individual. So if your employer is offering you benefits and you're not working 30 hours, I would imagine that's still considered primary and credible coverage. I'm not as adept in the employer group health coverage side of things. But as far as Medicare is concerned, if you have employer group health coverage, they don't know how many hours you're working. So as long as you have that coverage and you're being offered that coverage, then yes, that is your primary and it's considered credible.
Excellent. Okay, I have a couple of more questions that I wrote down because, you know, I'm always thinking. Can your HSA pay your Part B premium?
Yes.
They can. Okay, it can.
Pay
That's
your
good.
Part B premium, it can pay your Part D premiums, and it can pay qualified medical expenses. So if you
Okay.
have an HSA.
So all that money you've been saving up over all these years, tax
Yep.
deferred or tax exempt, then you can use that now to pay going down the road all these.
Correct.
Oh, how lovely.
Yes.
Okay, and then also I had a client who had kind of a big year last year because she sold a couple of properties and she had some income and she had kind of a big year. So can she expect Part B and Part D to go up for 2024?
So they'll be looking at 2022. So perhaps they will. Now, I did not mention this. I don't typically get into too much detail with this, but if her income is currently less in 2024 than it was in 22, she can appeal it. I can't say they're gonna.
She can appeal.
Yeah, you can appeal it with Social Security Administration. They may tell you, I'm sorry, but I've had clients do it and have success. And that's
that's something that maybe she can discuss with you on the in a sidebar or something.
Yeah, there's a form. I can send it to you, and then she would just do that with Social Security.
Oh, that's exciting.
Yeah.
So she doesn't have to take maybe such a huge hit just because.
Hopefully not. I mean, if her income is less in 2024 than it was in 22, perhaps she's
because it was kind of a one-off thing. All right.
Yeah, she's not making any income or very low income. They may accept the appeal.
Well, that's, oh, wait, hold on. Do we have more questions coming in? Hold on. Let me look. Making sure. Do we have any more? No, I believe that's all the questions.
Excellent.
If anyone has any more questions, type now or forever hold your peace.
Or reach out to me at a later date.
You also have Leigh's information, or we can always get it to you. And I just want to take this moment also, please, to thank Leigh Bennett again. Every year you do this, and every year I learn something new. So I am just so grateful to have you as our friend and as our colleague working with us on getting our people the best kind of coverage that they can get, especially my husband, but other people too, and during this time, because you just we're so grateful for you.
Thank you.
I also wanted to remind everyone the Carter Investment Conference is coming up on October 12th, 4 p.m. at the Communities Foundation of Texas. Please RSVP and sign up, and you should be getting information on that shortly. Deborah, do you have anything else to add?
No, nothing to add. Just thank you again, Leigh, and to all of you for joining us today. We really appreciate it.
Thank you. Bye, everyone.
All right. Thanks, everybody. And, contact us with any other questions you have. If something comes up later, we would be glad to answer any questions. And everybody have a lovely evening.
Thanks all. Take care.
Bye-bye.
Bye.